Go charge your tablet. Good afternoon, everybody, and welcome to the Love Ministries webinar. Today, I'll be talking about heart disease and type 1 and type 2 diabetes. Let me go right to my presentation. Hope all is well with everybody. So today's topic is heart disease and type 1 and type 2 diabetes. I'm Patricia Johnson, the Love Ministry. This one talks about heart disease. Heart disease and health center. Heart disease overall, heart disease such as a coronary heart disease, heart attack, congestive heart failure, and congestive heart disease is the leading cause of death for men and women in the United States. Prevently, including quit smoking, lowering cholesterol, controls high blood pressure, maintaining a healthy weight, and exercise. So we have about 6 different points. You have overall facts, you have symptoms and types, you have living management, you have diagnosis and tests, you have treatment and care for heart disease, and you have support and resource. Okay. And this article will basically give you a self-explanatory about how to maintain and how do you deal with heart disease. I'm going to kind of click on one of them to give you a better look about what to watch out for heart disease. The website I'm on is https://www.webmd.com/heart disease/guide/heart disease symptoms/types. So with this point I'm showing you right here, there's many type of heart disease. Here's where to get a quick fact on each one, including warning signs and symptoms. Heart disease warning signs. Here's a fast, easy understanding guide to the symptoms of each heart disease. So we're going to go right here and I'm going to click on the one about heart attacks. To kind of be aware, like, what are the signs? Symptoms of heart disease: coronary artery disease, congested heart failure, heart attack. Each type of heart problems require difficult treatments but may share similar warning. It is important to see your doctor so that you can receive correct diagnosis and proper treatment. Learn to recognize the symptoms that may signal heart disease. Call your doctor if you begin to have new symptoms or if they become more frequent or severe. Symptoms of coronary arterism disease. The most common symptom of coronary artery disease is ignitism or chest pain. Ignitism can be described as a discomfort, heaviness, pressure, aching, burning, fullness, squeezing, or painful feeling in your chest. It can be mistaken for indigestion or heartburn. Ignitis may also be felt in the shoulder, arm, neck, throat, jaw, or back. Other symptoms of coronary artery disease include shortness of breath, patterns, irregular heartbeats, or a flip-flop feeling in your chest, a faster heartbeat, weakness or disease, nauseating, and sweating. Symptoms of a heart attack can include discomfort, pressure, heaviness, or pain in the chest, arm, or below the breastbone. Discontinued rating to the back, jaw, throat, or arm. Fillness, indigestion, or choking feeling may feel like heartburn. Sweating, nausea, vomiting, or dizziness. Extreme weakness, anxiety, or shortness of breath, rapid or irregular heartbeats. During a heart attack, symptoms typically last 30 minutes or longer, are not related by rest or oral medicine. Initial symptoms may start as a mild discomfort that progress to significant pain. Some people have a heart attack without having any symptoms, which is known as a silent myocardial infarction, MI. It occurs more often in people with diabetes. If you think you're having a heart attack, do not delay. Call for emergency help. Immediate treatment of a heart attack is very important to lessen the amount of damage to your heart. What are the symptoms of arrhythmias or abnormal heart rhythm are present? Include having feeling of a skipping of a heartbeat, fluctuating or flipping in your chest, pounding in your chest, dizzying or feeling lightheaded, fatigue, shortness of breath, chest discomfort, weakness or fatigue, and feeling very tired. Arterial fibrosis is a type of let me pronounce this, arterials. Most people with AF experience one or more of the following symptoms: heart plump, I'm gonna call it HP, a sudden pounding, fluctuating, or racing feeling in the heart, lack of energy, dizzy, feeling fainted or lightheaded, chest, chest discomfort, pain, pressure, or discomfort in the chest, shortness of breath, difficult breathing during normal activities. Some patients with AF have no symptom episode may be brief. Now, the symptoms for heart valve disease, shortness of breath, difficult catching your breath. You may notice this may most when you are doing normal daily activities or when you lie down flat in the bed, weakness or dizziness, discomfort in your chest. You may feel a pressure or a weight in your chest with activities or when going out in the cold air. Pathogens, this may feel like a rapid heart rhythm and regular heartbeat, skipping heartbeat, or flip flop feeling in your chest. If the valve disease causes heart failure, symptoms may occur: sweating of the ankles, feet, swelling may occur in abdomen, which may cause you to feel bloated. Quick weight gain. Symptoms of heart valve disease do not always relate to the seriousness of your conditions. You may have no symptoms at all and have severe valve disease requiring proper treatment. Or as the mitral valve prelapse, you may have severe symptoms, yet tests may show minor valve diseases. Symptoms of heart failure include shortness of breath, coughing, rapid weight gain, sweating in the ankles, legs, and abdomen, dizziness, fatigue, weaknesses, rapid of irregular heartbeat. Other symptoms include nausea, panting, and chest pain. So with this content I'm sharing with you, ladies and gentlemen, here on the broadcast today, it's giving you things to look out for about heart disease. And another one, talk about congested heart dysfunction. Deficiency, not dysfunction. It's a deficit. Congested heart deficit or defectiveness. I've had a very, very long day, so I truly apologize, everybody. May be diagnosed before birth, right after birth, during childhood, or not until adulthood. It's possible to have a defective and no symptoms at the time. Sometimes it can be a diagnosis because of heart murmur or on a physical exam or abnormal EKG or a chest x-ray in someone with no symptom. In adults, of a symptom of a congestive heart disease are present, they may have shortness of breath, limited ability to exercise, symptoms of heart failure, C above, or valve disease, C, congested heart deficit in infants and children. Symptoms of congested heart defects in infants and children may include, I finally pronounced the word right. It's been a long day. I probably been here 2 hours ago, but life happen, things happen, everybody. I'm gonna call this one Cephanias, a blemish tint to the skin, fingers, and nails, lips. Fast breathing and poor feeding, poor weight gain, reoccurring lung infections, and able to exercise. This one is cardiopathic, has no symptoms or any minor symptoms and lives a normal life. Other people develop the symptoms which progress worse as a heart function worsens. Chest pains, of course, heart failure symptoms, swelling of the lower extreme, fatiguing, and again, fluctuating in the chest due to abnormal heart rate. So these are some of the things that you can see in the different areas of heart disease. So I'm going to go back to where I was the first time and click on the other link that I seen before I go to my next website. Sorry, everybody. Things popping up. I'm going to go back to this link here, and then it's going to talk about the heart attack. I want to click on the heart attacks aspect of it. And also, too, before I get started, on this site, it shows you different types of symptoms. So you have heart disease warning, one to call your doctor, coronary arterism disease, enlarged heart, heart attacks, irregular heartbeat, atrial fibrosis, heart rhythm disorder, heart valve disorder, sudden cardiac death, congested heart disease, heart muscle disease, dilated cardiomyopathic, hyperchoreopathic. It's a lot of big words. DC, HC, I'm pronunciating now, RC, P, PE, MS, HM. It's a lot of different topics, but what the one I want to click on is about heart attacks and how to be aware of those. And next month's webinar, I'm going to talk about high blood pressure. I'm going to talk about strokes. I'm going to talk about menstrual cycle and menopause. So look out for that webinar on the Love Ministry next month. I will have a flyer on the days and time that I'll be doing those segments on the main page. So with the heart attack, something blocks and blood flows to your heart. Excuse me, blocks the blood flow to your heart so it can't get oxygen. They said more than 1 million Americans have had heart attacks each year. Heart attacks are also called MIs. Myo means muscle. Cardio refers to the heart, and infraction means death of tissue because of the lack of blood supply. This tissue death can cause lasting damage to your heart. So this is symptoms of a heart attack, everybody. Discomfort, pressure, heaviness, tightness, squeezing, or pain in your chest or arm or below your breastbone. Discomfort that goes into your back, jaw, throat or arm. Fillness, indigestion, choking feeling, and may feel like heartburn, sweating, upset stomach, vomiting, and dizziness. Severe weaknesses, anxiety, fatigue, or shortness of breath, fast or uneven heartbeats. Symptoms can be different from person to person or from one heart attack to another. Women are more likely to have symptoms like an upset stomach, shortness of breath, or back or jaw pain. Some heart attacks, you won't notice any symptoms of silence, MI. This is more common in people who have diabetes. Your heart muscle needs a consistent supply of oxygen-rich blood. Your coronary artery gives your heart this critical blood supply. If you have a CAD, these arteries become narrow and blood can't flow as well as it should. When your blood supply is blocked, you have a heart attack. Fat, calcium, protein, and inflammation of cells builds up in the arteries to form plaques. This plaque deposits are hard on the outside and soft, muscular on the inside. Yes, yes. It's charged good. No. Shut the door. Sorry, everybody. Oldest. When the plaque is hard, the outer shell crust, this is called the rufus, platelets, disc-shaped things in your blood that helps it clot, comes to the area. A blood clot forms around the platelet. If a blood clot blocks your arteries, your heart muscle becomes starved from oxygen. The muscle cells soon die, causing permanent damage. Rarely, a spasm in your coronary arteries can also cause a heart attack. During this coronary spasm, your arteries restrict or spasm on and off, cutting off the blood supply to your heart muscle. It can happen when you are at rest and even if you don't have any serious coronary diseases. So this article here, I just gave you a brief description because you can go back and look at this content. Again, the website is www.webmed.com/heart disease/die/heart disease heart attack. And it had other different features. Just go through the website, everybody. If you're looking for information regarding heart disease or any type of heart issues, this will be a site to choose to look at and educate yourself as much as you can, everybody. I just want to kind of give you a snippet of what it looked like. And I'm going to head back to my presentation. All right, the next link. This is about betahealthy.com. Everything you need to know about heart disease. So in this particular area, it's showing you, that's not it. It's a picture of the guy holding his chest, okay? And then it's showing you, and some of this stuff they're showing him is just, I'm sorry, everybody. I'm going to go back to it. Got it. So like what I talked about in the last website I was on is basically giving you a basic description of what it is and how it affects you. So I'm going to read this little snippet right here. Heart disease are referred to as a condition that affects a person's heart condition such as a coronary artery disease. Arrhythmia, heart rhythm problems, and heart deficiencies are some common examples of heart disease among others. The term heart disease is often used and interchangeable in the medical field with the term Cardiovascular disease. A lot of you have heard about cardiovascular disease. I have. Cardiovascular disease, generally referred to the condition in which blood vessels become narrow and blocked that can lead to heart attack, chest pain, ignitism, or stroke. Various other heart conditions, such as those that affect your heart muscles, valves, or rhythms, also come under the umbrella of a heart disease. Okay, so this is just giving you a little snippet about what it looks like. Okay. I think there's more. Nope, that's pretty much the overall on that link. So I'm going to click this link off and go back. Excuse me about that. I got to click that pop off. Oh, that's showing too much. That off. All right. Moving on to my next one. I think I did a double. Yeah, I did do a double. So I can go ahead into the next one. What's going on, everybody? What's going on? All right. This one talks about the type of heart disease in children. So I did the adult part for the men, and it refers to the women as well. So now I'm talking about the babies now. Heart disease in children is a difficult enough when it strikes adult, but it's especially tragic in children. Many type of heart problems can affect children. They include congestive heart failure deficiency, viral infection that affect the heart, and even heart disease acquired later on in childhood due to illnesses or generic syndromes. The good news is that with advance in medicine and technology, many children with heart disease go on to live active and fulfilling life. So with kids, we have congestive heart disease. It's a type of heart disease that children are born with, usually be caused by heart deficiency that are present at birth. In the United States, only estimate 1% of babies born each year have CHD. CHD that affects children, including heart valve disorder, hypoplastic left heart syndrome, vascular spiral deficiency, architrave spiral deficiency, pathoduct archisons, technologic flaud, and these are some of the things that are affected in kids, as you can see. Okay, congested heart failure difficult deficiency may have long-term effect on child's health. There's usually treated with surgery, catheter procedures, medication, in several cases, heart transplant. Some kids will require lifelong monitoring and treatment. So there's another one here. It's called osteoporosis, a term used to describe the buildup of fat and cholesterol filling plaques inside of the arteries. As the buildup increases, arteries become stiff and narrow, which increases the risk of blood clots and heart attacks. It typically takes many years for osteoporosis to develop. It's usually for children or teens to suffer from it. However, obesity, diabetes, and hypertension and other health issues put children at higher risk. Doctors recommend screening for high cholesterol and high blood pressure in children who have risk factors like family history of heart disease or diabetes and are overweight or obesity. Okay. Treatment typically involves lifestyle changes like increasing exercise and dietary modification. This one here, I'm gonna call this one AT. It's an abnormal rhythm of the heart. This can use the heart to pump less effectively. Many different type of AT may occur in children, including a fast heart rate, the most common type found in children being an ST, a slow heart rate, a long QT syndrome, which is LQTS. This is something that should be aware of. The Wolf Parkinson White syndrome is WPW syndrome, weakness, fatigue, dizziness, fainting, and difficult feeding. Treatment depends on the type of AT and how it's affecting the children's health. KD is a rare disease that primarily affects children and can cause inflammation in the blood vessel in their hands. Feet, mouth, lips, and throat also produce fever and swelling in the lymph nodes. Resources are not sure yet what caused it. Okay, according to the American Heart Association, the illness is a major cause of a health condition to many, as 1 in 4 children. Most are under the age of 5. Treatments depend on the extrusion of the disease, but often involve primary treatment with the IgG or aspirin buffer. Cortisone can sometimes reduce future complications. Children who suffer from the disease often require long life follow-up appointments to keep an eye on their heart health. HM is a heart murmur. It's a whooping sound made by blood circulating through the heart chamber or valves or through blood vessels near the heart. Often it harms, other times in many signs is underlying cardiovascular problems. HM may cause by CHA, fevers, or anemia. If a doctor hears an abnormal heart murmur in a child, they're performing additional tests to be sure the heart is healthy. Innocent heart murmur usually resolved by themselves. But if the heart murmur is caused by problems with the heart, it may require additional treatment. Okay. The next one here, I'm gonna let everybody read this one real quick. My breath getting kind of short. Talking so much, it might get kind of dry. And then I'm gonna sit back and talk about this. A couple of things I want to share with everybody on this webinar today. Sorry about the incoming messages that really don't need to be coming in. Some are important, some are just spam. I don't know what's going on, people. All this spam they got going on, it's a real nuisance. It really is to me. I had to unsubscribe a couple of people. And I just unsubscribed these people. See, nothing but garbage. Stuff that really just clog up your phone. The next one, HRD. Viral infection. So what I want to say to you all, let me move my camera. What I wanted to say to you all about heart disease, diabetes, and my family, my granddaddy had it. He had a heart attack and strokes, and he passed when I was about 5 years old. And it was a lot. It was a lot to take in as a young child. He had a healthy life. I forgot his nickname, but all I know was I was a child. I talked to him. A lot of good times with my grandpa. The time that I got to know him, the time that I spent with him in my early youth. And to go back to think about some of the things he did and some of the things we talked about. It was just all love from my perspective, from my granddaddy. All love, all love. And I can say that's all love. Um, that's all I can remember being a young child was just all love. It was all good memories. Much love after all these years. And I'm 36 and he's been gone since 1989. Then my grandmother on my mom's side, she had heart problems. She ended up had to get a pacemaker in her chest to keep her going, but she had all other underlying conditions in her health. And over time that finally took her way down because she was dealing with other issues too, dementia and just a lot of stuff that was just really bringing her down, down, down. And the time that I knew my grandmother in my younger years and to the age I am now, she died in 2008. So she's been gone about 12 years now because my youngest child is 12 years old. But she was able to see me grow up to be an adult and to have my two kids. Well, my first child, but she wasn't here to see my two youngest. But she was here to see my first child. And I was very grateful for her to just see that and for her to just have those conversations and for her just to give me that guidance and wisdom and things. And I love her. Okay. But a lot of people who have gone home to the Lord, my granddaddy who had heart attack and stroke because he wasn't really taking care of himself in his life. And then my grandma, she did what she could, humble person, lovable. Her health deteriorated, ended up having heart problems, ended up putting a pacemaker, and she passed away from other issues in her body. From that to having my dad and my daughter to have both have type 2 diabetes really has turned me out to be an advocate to my own health to make sure I'm okay, to know people around me having these type of elements in their bodies and to know and make them aware to just take care of yourself. Um, just think about what I just talked about this afternoon and just a little family history I want to share with everybody with the love ministry. Um, Even though my loved ones had their elements and suffered from them and passed on, I can say I can advocate because I had experienced that in my own personal life, being at a young age and being in my teenage and young adulthood, and even at my older age, getting into my 40s. And to say I've experienced people who have heart disease and heart attacks and stuff like that. It's a lot for me to grasp for and a lot for me to talk about, but I want to just share that little throwback history about my history of my family background. It's a lot more in detail about that, but I wanted to kind of give it to you in the short version because if I sit here and talk about every significant detail, I will be here till about 4 o'clock. But I just wanted to make you aware that I have history of people who have heart problems, strokes, and heart disease, and anybody who's in my family who has diabetes, which is my dad and my oldest daughter, both type 2, and my granddaddy too, the one who had the heart and the stroke, so he had diabetes too. So it's a lot. It's a lot for a person to think about, a lot for a person to explain. But I wanted to share that with everybody. So this website here I'm sharing with you today, let me go back up, everybody. It's www.healthline.com/health/heart disease slash in children. I'm gonna go say AC ascarosis. Okay. All right. Now it's gonna make me jump through hoops. Now let me go back. In fact, let me stop this presentation. But then again, I'm gonna give you the link because I can't click on it. So I'm gonna do this for y'all, everybody. The website is www.hospicemedical.org/health/condition and diseases/heart murmur in children. Heart murmur in children. I can go back and think about I had a classmate who had heart murmur and heart mumble trouble. And to be honest, he was in and out of the hospital having episodes after episode and having heart attacks at a young age. And it was just very distressful and very, very intense to know somebody you go to school with having these things going on with them at a young age. And for me to witness to somebody who had heart murmur problems, they were serious about that. Excuse me, he was serious about that because he always had problems. The ambulance was there periodically throughout the entire school year, the whole time he was going to the school I was going to. And for him to say he had a heart murmur and all of these problems going on, it was intense to see a child, or excuse me, a young teenage boy go through that. It was stressful, it was challenging, it was difficult. For me, it was a bit confusing and really didn't really get the full grasp of. what it really was like until you actually have to live in those shoes. And when you have to really live in those shoes and understand what that feels like to have that situation in hand, to how do they cope, how do they deal with it, how do they face these things? And that's a lot to think about, everybody. It's a lot. So let me move on to my next presentation. All right. Hopefully these videos will play, everybody. Hopefully, because Monday, me and these videos was having some mad issues. So y'all just hold tight. We're gonna try it today, y'all. Hold on. Let's try it. See if it's gonna work. I'm gonna take my microphone off.
Hey guys, welcome back to Medwich Made Simple. In this video, we're going to say about heart diseases in pregnancy. Let's begin. Okay, the most common heart diseases which complicate pregnancy are mainly two, which includes congenital heart diseases, which are present right from birth, and rheumatic heart disease, which basically.
How long are you staying in here? Actually, I'm recording. Can you turn that off? I'm recording, so I have some respect. I have a headache. Okay, and I'm recording. You got a migraine, get up your phone. Sorry, everybody. Can you please turn that down?
I don't have my headphones.
Turn it down.
And I can't hear it.
Because I'm doing something. Have some respect.
I'm trying to have some respect.
No, you cannot. I'm not going to argue on my broadcast. I'm sorry again, everybody.
Congenital heart disease. So, Okay. Quiet.
All right, everybody, going on to the next video. The content I'm sharing today is very long, but it's very educational and informative. I'm going to play half of this video. It's like 16 minutes long. I'm gonna stop at 4 minutes. Hmm. I'm gonna move on to my next video. The video for this one is adult congested heart disease 101. You can find that on YouTube because I got another few minutes before my Zoom cut off because I'm only scheduled for an hour here. right, everybody, tune into the next video. This one may not have closed caption, ladies and gentlemen. Oh, there it is. Okay, everybody, I'm going to stop that video because of time. Very mindful of people time and my own time. Let me get to my next slide. This presentation was the heart disease in adults and kids. So now I'm going into type 1 adults and type 1 in kids. So let me click on my body. I got to keep up the time. I don't want to go past the hour. Broadcast. So in this slide, it talks about let's fight together. Type 1 diabetes together. So do you know anybody in your family or someone around you that has type 1 diabetes? This is some of the information to kind of help you get a better understanding of what this disease is and how it may benefit you to know this information, as well as somebody who has this situation, somebody in your family or yourself. And it's good to be an advocate with your diabetes, to speak up for yourself and to just educate yourself about. And this link is the American Diabetes Association. And this is basically giving you information about it. First and foremost, I want to tell you about diabetes by experiencing it in my own personal family. See my relatives go through this. In the beginning, I'm gonna be honest with you, it's the most scariest thing by far, because when you're not educated, you don't know what to do, you don't know how to handle it, you don't know how to manage it, because it's something new to you, you don't know how it looks, you don't know what to do and how to do it. For me alone, it's challenging for me and my spouse, and the simple fact that our child is going through this, and we didn't know at the time was a type 1 or type 2 situation, shows that us as parents were scared and terrified because we didn't know how to handle it. We didn't know what to do, but by us being about people who's educated in this line of work to help us through that, gave us a better understanding how to count carbs, make sure that the person who has that doesn't eat too much, but eat the right amount of carbs, to take their insulin. They have the short-term and they have the long-term insulin that you have to take. You have to make sure you alternate where you put the shots at in your body. And that is just talking about in the children aspect of it. As for an adult, they have to manage it a different way. They have to do the same thing in terms of managing their diet, checking their glucose, taking their insulin, and counting carbs too. apparently, or maybe not for adults, but children definitely. But they have to basically make sure they're taking care of themselves, making sure they're eating the right stuff at the time so they can keep their blood sugar at the right level and the right way. And it's a challenge and it's a battle and it's a struggle dealing with diabetes alone, just personally in my own backyard. Yeah. So this here is just basically a manual here. And this manual is just giving you some informative information on what to do and how to do it. What I'm gonna do is, everybody, if I could, I'm gonna download this. Okay, I'm gonna download this PDF, and what I want everybody to do now, I want you to go type in the search engine for Facebook. Type in the search engine On-Time Ministry, and there you will find that in my platform. I will probably have this up by the end of the week when I'm doing all my webinars. But I want you to be informed, and I'm gonna probably share these webinars on the On-Time Ministry page. So those of you who are not a part of that page that I have, you can by all means go check it out. But I will upload that. If it's not up on TM, I'll make sure I put it in my group page. So those of you who are now on the page, it is open for you to go check it out to see what this manual looks like. Okay. So this is what it looks like. It's a self-manual, and it probably have 209 pages. I'm not going through because I'm crumped for time. So this is what it looks like. And I believe other things, but I'm gonna definitely upload it for everybody so they can take a snivel at it. I'm not reading 209 pages. Okay? So that's what that looks like for type 1 diabetes. Okay? This is what the PDF looks like. So I'm gonna make sure I do that by the end of the week. Okay, everybody? All right, moving on to my next part. This one here is healthprep.com/diabetes/10 incredible diabetes treatments for seniors. Now we went from to the adult aspect and then some of the kid aspect to talk about the diabetes in seniors. So here's 10 things. They have reduced stress, and she's meditating. Then we have, they're not gonna make me read today. Ordinary autism disease prevention. See, he's doing push. You gotta be healthy when you're dealing with diabetes, everybody. You gotta stay healthy, you gotta be walking, you gotta eat right. Foot care is very important because when you're a diabetic, please, by all means, wear white socks because people who have neuropathy, they don't have feelings in their feet or their hands. So they can't tell if they're cut. Neuropathy is like a burning sensation in your hands and feet. And some can't feel any feeling in some of their hands, sometimes their feet. So when they get cut, this is why they wear white socks so they can see if they're bleeding. Okay, just an FYI. Foot care is very important. Please do not get cut because it's hard for the people who are diabetic. It takes a long time for them to heal, and they can end up getting an infection from that. 7, insulin. Test is very important. Make sure you take your insulin also too. Please make sure there's no bubbles in your insulin because you can't take it when it's got bubbles in it, everybody. Okay? Testing. Testing to see what her glucose is. Number 6, metabolism. It's an oil drug suitable for some seniors with diabetes because it helps control past meal hypogens and lower the risk of hypogen. This particular drug works quickly, so it benefits for those who have poor retinal functions or whose hydro is more consistent and severe with others using the anti-drug called Cephalin, high price drug. So for this is long for those who are having, some problems. And they need to take this being a diabetic. Okay, moving on to the next point. Sodium glucose co-transporter 2 inhibitor. So this here, it looks like to me, because I've never heard of this one, it presents a new option for senior population because the trial of 2 drugs in this class have reported a lower percent of users experiencing hypolysis. The drug also appears lower blood pressure and promotes weight loss. It compares to Flatbush, and other drugs. However, the glucose reduced statistics are consistently lower. So the C transporter, I cannot even tell you because I have never heard of that, to be honest. Something that the seniors are using to kind of manage their glucose, what I'm picking up on in this article. This one here is diapathic 4 inhibitor. Again, it's another thing that seniors are using to kind of help them and manage them to kind of keep their glucose on check. So I'm gonna let you read the article just a little bit to kind of get an understanding of what this looks like, everybody. Okay. On to my next point. I'm looking at the time, y'all. I gotta get off at 4. This is another pill they're taking. This one is sulfonescence. It helps with insulin sector from the pancreas. This is a drug that kind of helps, pretty much from my understanding, it helps clean up some stuff and make it for them to manage. And by them taking that and other supplements, they kind of help them manage their diabetes and kind of put it on court and off of the pancreas. Okay. All right. Metformin. I know all about metformin. Metformin is a drug. It's a drug that diabetics take. It's the different with insulin. Metformin, you can take that as a diabetic patient, and also too that some people it works other areas of the body too. It prevents cancer and it helps manage some things. And taking that tablet, it depends on what kind of doses the doctor recommend you. Your oncologist can recommend you a different type of dosage depending your where your diabetes is at. And with this here, this is taking, it can be once a week, excuse me, not once a week. You can take it in the morning, you can take it at lunchtime, you can take it at dinner time, but you have to take it before meals. You have to take it before meals, then wait a little while and then eat so it can dissolve into your stomach along with your food. That builds up your insulin levels. I'm gonna say that again. It builds up your insulin level. Do not just take the pill and don't eat, because you have to eat when you take the pill because it irritates the stomach. Okay? It irritates the stomach. Lifestyle changing. Diabetes is a lifestyle changing, everybody. When you're a diabetic, you got to make some maneuvers and you got to make some adjustments, and you definitely got to make some changes in your life to live a healthy and balanced life. It's challenging, but it can be done with the proper nutrition and people guiding you. Some people need a nutritional guide, a counselor, or a dietary counselor to kind of just keep them on track to make sure they're doing what they're supposed to be doing, managing their type 1 diabetes, excuse me, and to help you manage that. Now, a lot of you asking questions like, how are the children dealing with that? That's a whole nother resume right there. But the link that I'm sharing for the seniors who have diabetes is healthprep.org/diabetes, 10 incredible diabetic treatments for seniors /11. See it right here at the top of the right. Okay. So I'm moving on to my next point. So I'm gonna give you a couple links right here and I'm gonna get to the videos of it. So the one for the children is https://www.jdrf.org/the coronavirus. This is talking about how they're handling the pandemic and how are people with diabetes dealing with this during this trying time. And the next link I have is https://www.diabetes.co.uk/news2020/MR/recovering from COVID-19 with type 1 diabetes.html. But the HTML might pop up, so just eliminate the last word at the end and kind of type that in and see what comes up. And then the next one I want to show you is right here. Hopefully this one pops up, and then I'm gonna get to the YouTube videos and moved on to type 2 diabetes. And I think I have one more slide, and then that'll be it. So I did find something in kids. Hold on, everybody. There we go. So type 1, what is that? So it's basically talking about diabetes is a disease that affects how the body is using glucose, okay? A sugar that is built main sources of fuel. Your body needs the glucose to keep running. Here's how it works. You eat glucose from the fuel, gets in your bloodstream. Your pancreas makes hormones called insulin. Insulin helps the glucose get into the body cell. Your body gets the energy it needs. Pancreas is long, flat cells in your belly that helps you build digestive food also makes insulin. Insulin is a kind of light key that opens the door to the cells of the body. It lets the glucose in, and the glucose can move out of the blood and into the cells. But if someone has diabetes, the body either cannot make insulin or the insulin does not work in the body like it should. The glucose can't get into the cells normally, so the blood sugar level gets too high. Lots of sugar in the blood makes people sick if they don't get treatment. So what is type 1? In type 1, which is usually called insulin-dependent diabetes or juvenile diabetes, the pancreas cannot make insulin. The body can still get glucose from food, but the glucose can't get into the cell where it needs to. Glucose stays in the blood where it makes the blood sugar level very high and cause health problems. Okay, to fix the problem, someone with type 1 needs to take insulin through a regular shot or insulin pump. So the regular shot is like this. It's in a regular shot can be for adults. They'll usually have it like in a small little thing. You have to refrigerate it and make sure you change the needle and make sure you measure it up the right way and make sure there is no bubbles inside that, because it's no good to put it in your body. And make sure when you're taking your insulin, you put it in a different part of your body. You don't want to use the same thing all the time. And with the pump, it's actually automatically attached to you, so that way you don't have to worry about, oh, do I have to take my insulin? Oh, what is my insulin? Did I forget to take my insulin? The pump is working for you, so it's pumping insulin already inside of you. Okay. Type 2 is different from type 1. In type 2, the pancreas still makes insulin, but the insulin doesn't work in your body like it should, and blood sugar levels go up. So with type 1, it's not making insulin, but the glucose from the food is causing problems, and it stays in the bloodstream, so you have to use an insulin needle all the time. With type 2, the pancreas still makes insulin, but the insulin doesn't work in the body. So the pancreas still makes insulin, but it's not properly traveling in the right part of your body for you not to have diabetes. Okay? So let me explain it to you again. Type 1, the pancreas can't make insulin, so that's why they need the shots. Type 2, the pancreas still makes insulin, but the insulin is not getting in the proper area. So this is why you still have to take the insulin shot or the diabetic pill to make sure your insulin is going in the proper direction. Okay. So here's a few signs about type 1 diabetes. Pee a little, drink a lot, eat a lot, lose weight, and feel tired a lot. That's the signs of type 1 diabetes. How is type 1 treated? So basically, you're taking insulin as the doctor prescribed. You're eating healthy, you're balancing diet, you're checking your blood sugar as prescribed, and getting a regular exercise. You're testing yourself. So test yourself morning, noon, evening time. And no testing strips are, I'm going to tell you right now, you get the brands that you get. You can get the Freestyle brand, you can get the AccuCheck brand, you can get the store brand, and a lot of the testing strips are costly. I'm telling you that right now. A lot of the machines are costly, and make sure you have a supply that you don't run out, because we have emergency and things that happen, and diabetics need their insulin, their testing strip, their alcohol wipes, and their machine to be working. And also, too, make sure you check the batteries on your testing kit, testing machine, so that you can continue to read, so when you go to the doctor, they can see an average of how much you have tested in those weeks that you've been away from the doctor. Have you been doing your part as that patient? With type 1 and type 2, have you been testing properly? Have you been keeping a track of what you've been eating? How was your blood sugar this week? Was it too high? Was it too low? Did you take your insulin at the right time? Did you take the right dosage? Did you put too much? Did you do too much? You have to be careful. You have to manage. It's like a full-time job when you have a diabetes. You got to really be watching your stuff. Seriously, you really have to watch it. Okay? All right, here we go. What else should I know? Although this might seem a lot of work, the good news is the new products and equipment can help you make it easier for children to take care of their diabetes. Scientists are looking for ways to make it easier to check glucose levels and giving insulin. There's also trying to find ways to get insulin to the body without shots, and their hope that one day a cure will be found. So the site that I told you in the presentation, the JDRF, this is a foundation. It's a diabetic foundation. for type 1 diabetes. And actually, since I'm thinking about it, I'm going to type it in the search just so you can kind of see jdrf.com. Excuse me, it's probably or, but it's been a long day, so I truly apologize. I want y'all to see what the site looks like. You can sit here and tell somebody what it is, but to actually see it visually, this is what it looks like. This is an organization for those who have type 1 diabetes. And it's just basically a place where you can get connected with people who have this. And you don't feel alone because you're going to the meetings, and you're having conversations with them, and they're giving you information and resources. And this is for type 1 diabetes. And I want to say this, that I talked to this organization when my oldest was first diagnosed with it. Lovable, supportive, very informative. And I'm telling you, they give you so much information, they give you so much love, and they're giving you so much hope. This one, with people dealing with diabetes, you need hope. You need support, you need hope, you need love, and you do not want to feel alone. Because there may be questions and answers that you may not get from people that you know, but you can get it in this support group. So reach out, because I don't know how they're doing their meetings now, if they're doing virtual, whatever the situation may be. I don't know how they're running their show, but this is what this website looks like. So I'm just going to show you how it looks like. And this, it says National Diabetes Awareness Month. In the month of November is National Diabetes Awareness Month. Okay. And this is basically things that they have to share, and guidelines and things they want to do. And they give you information how they're doing everything right now. This is a very useful organization. They're very helpful. They're very informative. They're very loving, and they're definitely very supportive. And they have been a blessing in my life. Okay. So make sure you look at this website for type 1 diabetes. And also, too, they give you some information for those who are type 2. They kind of help you along the way, just give you some insight on how to handle that as well. Okay. All right, let me give you a couple of videos. I just realized one of you plugged into the microphone, but it's all good, and it's all good in Rockaway World. Okay. So here we go. Uh-oh, we on this again, y'all. We were doing good. We were doing good, and that video mess starting up again. Oh boy, we on this again. Man, we were doing good in this presentation, and then it started up again. Oh boy. Hold that thought. It's starting up again. I just won't let my remarkable be great in this presentation. I don't know what it is, but this is the second time this happened this week when I got on this webinar. It just be buffering and buffering and buffering. Now, the first presentation of the first part of the segment was good. It looks like I'm going to have to skip this video so I can get this presentation done. I'm not going to play this game today. Let me click this off. Let me stop sharing my screen, everybody. We're going to try this again. Oh, we're going to try this again. We're not going to let this. Nope, not today. Oh, no. Not today. Hold on. Give me a minute. I'm going to come back to my presentation. I'm going to tell you the sites to go to look at these videos, because it's not going to go down today. It's not going to go down today. I rebuke that in the name of the Father, Son, and the Holy Spirit. Not today. Fall back. That forward. So let me get back to my presentation. Hold on. I'm going to get back on here real quick, everybody. It's not going to go down today. It's not going to, nope. That thing had me big mad last time. Boy. I had to cut my presentation short because this is acting up. So I'm going to click back on here real quick, and I'm going to go ahead and let you know the videos that you can look up on YouTube and get off this platform, because I know what I'm doing is magnificent. That shady devil that came in try to stop my little presentation with that, and I'm not finna let it happen today. No ma'am, no sir. So I'm going to come back to it, and I'm going to share it again. I hope I click the right presentation. All right, we're going to go right back to it. Yes, we are. All right, back on it. Let me go back to where I was. I'm just going to give you the videos, because I got a feeling I got some stuff going on here, everybody. And I can feel it happening. So I'm going to hurry and get off of here. Internet get weird. Go back to my slide. All right, there we go. All Right. These are the links right here. This one's called Adult On-Site Type 1. This one is Type 1 Diabetic. Looks like Thriller or Thrill. This one is What is Type 1? This one is Managing Type 1. So when you type these in the search engine, they will automatically pop up for you. So let me get to part 2 before this internet get crazy. So this one here for type, you know what? We're going to try this one for 2 before I get to the website. Let's just see. Oh, it did it again, y'all. Yep. Some say try it. Nope. Wouldn't play the game. Wow. Hold on. Maybe. In a minute, babies. Ladies and gentlemen. Baby girl, baby boy. Mm-mm. Mm-mm. It did it again. Not playing the game, huh? Wow. See what happens? That devil boy. Big mad. Oh, that thought. See, it just went completely hybrid. This is the same thing that happened. A lot of you like, dog, what's going on with your webinar? It's not me. It's what I'm saying. It's the power. And I've done a lot of webinars. And by far, I'm having so much trouble. But I'm gonna go ahead and go to these links and I'm gonna share the videos with you and get off of here. Because it keep doing like it did the other day. And I'm not gonna play the game. Nope. I'm not gonna play the game. I'm gonna go around the game. Share it, give you the links, and give you a video so you can find it for yourself. Because if I sit here for another 25 minutes, 30 minutes playing with this video thing, I won't get nothing done. I'm gonna go around this. Hold on, y'all. I'm gonna go around in this today. I sure am. Serious, ma'am. And now the screen completely black. How is that possible? So now I really big mad now because I'm going around. All right, we're gonna do it this way. All right. So we did this one, this one, this one, and this one. I'm gonna just go ahead and give you the links since my presentation want to be a little shady right now. So with the ones for type 2 adults and children, the link that I'm giving everybody is www.diabetes.org/diabetes/type2. The next one is www.diabetes.org/type2, look like I did it twice. And then the second one is health.usnews.com/conditions/diabetes/diabetes in children. And this one here is healthprep.com, diabetes, 8 commonly mistaken symptoms of type 2 diabetes. And the video here, I'm trying to figure out what's the video called, but my presentation acting up. If you type in the search engine, cephalus side effects, hopefully this pops up. If not, then I have to come back another time to give you the right title for that link, okay? So the video here you see is teens with type 1 and type 2, and it talks about diabetes on this platform, and it talks about corona and why diabetes are higher, okay? Heart disease and medication in adults. So here's a link for medication for adults and heart disease in kids. So the link for this one is www.heart.org/en/health topic/heart attack/treatment of a heart attack/cardio medication. The next one is www.bearaspirin.com/heart/health. And the next one is www.drugs.com/CG/congestive heart disease in children. And as you can see right there, there's a video. I would play it, but my presentation gonna go black. This is why I'm orally telling you, everybody, okay? And the next one, it will be heart disease, medication, and adult further. So this one, you can find all these videos on YouTube, medication of a heart failure, heart disease versus heart attack. It's a Khan Academy video. And then the next one is heart failure treatment, early signs. So with that being said, everybody, and I don't even think I shared my screen, y'all. It's running my mouth. Hold on, y'all. Y'all like, all remarkable. Let's go back at it again, boy. This presentation whacked out. See that devil sitting there, he. I got the last say all back. That part. So there we go. So these are the links I'm talking about, everybody. This is for the diabetes 2 for adults and children. This is the video I was talking about here. This one here is type 2 for the teenager, and the illustration of what that looks like in that video here. This one is talking about the different medications that can be taken, as you can see. I'm going to leave this up for just a few minutes, everybody. In the video, we're talking about congestive heart disease. The next video talking about heart disease, medication, and adults. Further information. This video here can give you a better illustration about some of these things, since my video presentation is trying to shut me down. And the Love Ministry, thank you. My email address is ontimeministry2@gmail.com. Patricia Johnson, you see the picture said God time, not yours, God's people with the cross like that. All right, everybody. Thank you for tuning in since my presentation got cut in half, unfortunately. I'm gonna stop sharing my screen. So I hope this was very informative and very educational. So I will talk to you all tomorrow. Tomorrow's broadcast is entitled Child Abuse and Neglect. Hopefully my video footage will be working. I'm going to check on that this evening. Hopefully it'll be better than it was on Monday and today. But I'm going to keep it moving. I always have option B, C, and D to alternate and make it work, everybody. Again, my name is Patricia Johnson. I am the founder of the Love Ministry. Have an amazing and blessed Wednesday, and I will see you all tomorrow at 3 p.m. Zoom webinar entitled Child Abuse and Neglect. Have an amazing and blessed day. Take care, everybody.